Alright, my name is Matthew Sepsic. This is chapter 19 from our book, which is my assignment. Let's get started. So I had behavioral disorders. Listed on the screen are several of them in the book that we'll be going over: depression, anxiety, substance abuse, eating disorders, attention deficit disorder, and pervasive development disorders. First one's depression. General characteristics: sadness, low spirits, frustration, things like that. There's an increased risk with disability and mortality. Mean age is 40 for people that have this, and half of the patients have onset between 20 years old and 50 years old. There's major depressive disorder. Twice as many women have this than men. Common onset is around the age of 40. It's kind of like midlife crisis kind of thing going on. Chronic condition with over 50% having a relapse, so you kind of go through it and then you go through it again. Symptoms: weight loss, weight gain, insomnia, hyperinsomnia, things like that. You can read more of them on the screen right here. Some more signs and symptoms in the diagnosis: bereavement, loss of a loved one, but not a mental illness. So this happens to a lot of people when you lose a loved one. A couple more things I'd probably add to this that's not on this slide would be drinking, drug abuse, things like that. A lot of us, when we lose a loved one, like to drink. Adjustment disorder and depressed mood. So you could read some of the things on here. Stressors exceed patient's ability to cope with affectability. Impaired functioning, withdrawal, inhibition in work, school, relationships, and social functioning. Usually less than 6 months, but can last longer. It's not severe to qualify as other diagnoses are. Dysrhythmic disorder. I can't say that word. Common in women 64 and younger. Usually coexists with other mental conditions. Alcohol and drug abuse are common. You can read all of this stuff on the slide. I have listed for you from the book. Postpartum depression. 80% of women will feel mild depressed mood. Peak at 10 days after birth and subside around 20 days after birth. 10 to 50% of women will suffer from more severe and debilitating symptoms. I'm going to have to call Lars out on this one. He has 3 kids, so he probably knows a little bit about what's going on in this slide. I'm probably going to suffer from that in January. High onset between 15 and 24 years of age. This is bipolar disorder, by the way. There's 2 types of bipolar disorders: bipolar 1, bipolar 2. This is more commonly found in women. Reoccurring episodes of mood shifts. There are major depression, mania, things like that. It's very important to differentiate. I can't say that word. Separate the two between major depression disorder and treatment is different. Bipolar 1 experience 1 or more manic episodes or mixed mood episode and at least 1 major depressive episode. Bipolar 2 experience at least 1 hypomanic or 1 major depressive episode with no manic or mixed episodes. Treatment of depression. Caffeine should be avoided. Behavioral therapy, reading a book or listening to music, and exercise. Nutrition and elimination assessments. Drugs will always fix it. Suicide prevention. Recommended that each patient with depression be assessed for suicide risk. Must be alert for signs of suicidal ideation. And this is something we do in the hospital all the time with every patient for suicide prevention. Anxiety. These are all your symptoms: headaches, perspiration, palpitations, tightness in the chest, things like that. Some other things: depression is a comorbidity in 50% of people who have anxiety. These people can be at risk for self-harming behaviors and substance abuse, suicide thing. Keep going on this one. Panic disorder and pain attack. They recur unexpected panic attack. 1 month of persistent concern about having attacks. Symptoms: duration of 20 to 30 minutes, but not longer than an hour. Fast heart rate, nausea, chest pain, things like that. Treatment: just avoid caffeine, cold medicine, nicotine, and alcohol. You get medications that help with these things, and try to normalize your routine, your sleep pattern. Back on that last slide, it wasn't supposed to be pain attack at the bottom. Heading was panic. I don't know what I was thinking when I put that in the slide, and I read it like a weirdo. Anyway, let's move on. Agoraphobia. Translation is fear of the marketplace. Patients fear crowded places. Most frequently happens with panic attacks. Treated with life adjustments. Fear can leave patient homebound, unable to lead normal life. This is my big thing. I don't like going to crowded movie theaters. That gives me a panic attack. I don't like people looking down at me, so I have to go early. I kind of suffer from this a little bit. Social phobia and social anxiety disorder. Irrational fear of humiliation, failure. Peaks typically in the teenage years. Blushing, heavy sweating, nausea, trouble speaking, high anxiety, all symptoms of this. Constrained relationships and lifestyle. So it makes people not want to give a good presentation because you're too scared to be up there to fail. Specific phobia. Persistent, unreasonable, and excessive fears to a particular thing or situation. So these people are afraid of a certain thing. Natural environment, blood injection, and injury are most common in children under 10 years old. Situational phobias such as heights and going over bridges appear most in patients 20 years old. That's a typo, I believe. 24. I don't know. 20 to 40 probably is what I meant to put there. I don't know. 2020 is a show. Cause of bradycardia, hypotension, and fainting. Most common form of anxiety. You rarely have to seek medical attention. Keep going. Obsessive compulsive disorder begins when in early adulthood. Obsession, regular, intrusive, anxiety-producing thoughts, compulsive, conscious, standardized, recurring behaviors. Tension arises as the patient tries to resist the task. Everyone knows what obsessive compulsive means. Acute stress disorder follows observation and experience of an actual event or threat. Fear, hopelessness, and honor followed by 2 days of horror. Followed by 2 days to 4 weeks of impairment. May experience flashbacks and nightmares, causes social and life impairment. Post-traumatic stress disorder. Hear a lot about this with the whole Iraqi war thing and everything, and our soldiers come back. So everyone kind of knows what this is. You can read the slide. Don't really explain that too much to anybody. Generalized anxiety disorder is the most common anxiety disorder because it's generalized, I guess. Excessive worry and anxiety about events for a period of at least 6 months. Patients are considered to be uptight worriers by friends and family. Common to see mild depression symptoms with this disorder. Management of anxiety. Find out where the anxiety is coming from through a thorough assessment. Medications always help everything. Behavioral and cognitive therapy is also used with these patients. Substance use and abuse. Common in all ages and lifestyles. Most common substance abuse are alcohol, amphetamines, cannabis, cocaine, opioids, things like that. High-risk behaviors associated with abuse such as car accidents, homicides, suicides, rapes, domestic abuse. High-risk users are often overuse. Eating disorders. A bunch of these: anorexia, bulimia, binge eating, obesity. Anorexia, weight less than 85% of normal for the appropriate age and height guidelines. These people are super skinny. Two types: they're restricting their eating, binge eating, then purging. Basically, these people are super skinny, and that's their eating. Bulimia, eating a large amount of food than most people do and sensing a lack of control while doing it. Behaviors such as purging, laxative abuse, enemas, diuretics, exercise and fasting occur to avoid weight gain after binging. They might have normal height, weakness, swelling of hands and feet, headaches, dental erosion, big sign of binging or purging. A lot of the signs and symptoms are similar to anorexia, though. Binge eating disorders, lack of control, and distress from binging at least 2 days a week for 6 months. They have to have 3 or more of the following symptoms: eating large amount of food without being hungry, eating by self to avoid embarrassment, eating large amounts of food without being hungry, guilty, depressed, and bad about oneself after a binge eating episode. I think I'm going to say mad about oneself. Common in those 40 years old and obese patients. Obesity, most common medical problem and is difficult and frustrating to treat. Body weight greater than 120% of expected weight for height and age. Genetic and environmental factors are common in these patients. So obesity, a huge problem in America. We're all aware about this. Treatment of eating disorders, medication sometimes, behavioral therapy, mental health therapy, acute treatment for any medical conditions, bariatric surgery considered for some people that are morbidly obese. Attention deficit hyperactivity disorder. Any combination of 5 or more symptoms of inappropriate inattention, hyperactivity, impulsivity prior to age 7 in 2 or more settings. Found in males 3 times more often than in females. No definitive test or comprehensive evaluation used for this diagnosis. A lot of this times is over used in kids, but it is a big problem now. You can read a bunch of these symptoms on the page here, and I'll give you a minute to read them. Treating with behavioral therapy at school and at home, pharmacotherapy. I can't say that word. Education of both caregivers and child is important. So, the caregivers are important in this one. Pervasive development disorders. Examples of types: autistic disorder, Asperger syndrome. These are usually diagnosed or made before age 3. More common in boys than girls. mental retardation, seizures commonly associated with autism. And you could read the rest of these. Trouble connecting with, communicating with peers. Treatments usually with drug therapy, behavioral and environmental therapy.